So, have you ever wondered why you continue to struggle with symptoms, but your doctors continue to tell you that your blood work's fine or you don't get any support? I mean, optimal health. And today I'm going to uncover exactly what those clinical reference ranges mean, how to understand what your optimal health is, and strategies that you can implement immediately to start supporting your symptoms. And so, I feel like it happens all the time, right? It's like, why is it that you're struggling with symptoms and that every single time you go to the doctor, they tell you it's within range? And I think it's the most frustrating situation, right? Because you get the courage. You're so frustrated with the symptoms. You're like, okay, I am making this appointment. I am going. You're going to talk to your doctor. You're going to share everything. You're going to have this, in depth discussion about what's happening, and they order blood work. So you rush to the lab to get it finished because you're like, okay, the sooner these results come in, the sooner I get answers and the sooner I get to feel my best, right? Only to find out that after that entire process, your doctor tells you everything's within range or it's normal, or they need to just, watch and see what happens over the next few months, right? Well, you're not alone in this. Not only did I deal with this myself, trying to uncover my 5 autoimmune diseases and my hormonal disruption, but I've supported thousands of other women in the same exact scenario, right, who were struggling with symptoms and could not get any answers or resolution. And the reason this keeps happening, right? You're not crazy. The reason that you can't accept blood work at face value is because clinical reference ranges and optimal health are two completely different things. And clinical reference ranges are used in traditional Western medicine to determine the onset or need for intervention at a pharmaceutical level. Integrative nutrition, integrative health uses blood work in conjunction with symptom patterns to determine your optimal health. And so, before I can dive into this in more depth, we have to start by defining what is a reference range. And a reference range is a set of values that include upper and lower limits that is used based off of tests or averages of a group that's otherwise deemed healthy. And these values help to determine, where an individual falls. And there are multiple factors that influence it: their age, their sex, and the specimen type, right? Whether it's blood, urine, spinal fluid. And these reference ranges are also influenced by other situations such as fasting or exercise. But the intervals that they determine based off of the average or the mean of the population are thought of to be as normal. Again, today's medicine, in Western medicine, we use clinical reference ranges to interpret blood work based on the need for pharmaceutical intervention. So it's going to say, okay, yes, your HA1C is above 6. It's trended this way for a while. Type 2 diabetes or the onset of diabetes, we need insulin. It doesn't catch the progression towards a disease. It doesn't catch the onset of a disease, and it's not done frequently enough to say, okay, we're seeing a trend line, let's intervene with a lifestyle. It basically says you're there or not, black or white. And these reference ranges are set by testing a large number of individuals who have key similarities and observing what's typical for them, right? So if a group of women, all 40 years old, have their blood tested for their glucose levels, right? It's going to use the average of what's typical for the onset, no presence of disease, right? But again, this isn't very helpful because our population, most individuals today are struggling with one, if not more, chronic conditions. And so these chronic conditions such as heart disease, diabetes, all of that, obesity, they influence and skew the means and the averages. So as our population continues to change, as we continue to see more and more disease, we're going to see those reference ranges change. And the hard truth is that we can't compare your optimal health to what the average is, right? Because you're different. We also see so many common issues with reference ranges because there's something called statistical variability. So it's based off of a bell curve, right? Where 95% of the people are going to fall within that average. But there's 5% on average that either going to be high or low within that population. So they fall outside the limits. They also fail to account biological variability. So if your provider runs the same test on you at several different occasions, there's a good chance that one of those test results might be different because of your blood levels at that day, because if you had alcohol, if you changed your foods, if there's hormonal fluctuations, which is huge for women. And so that can skew. And so even if it falls without range, if they don't see it happening consistently, they say, we're going to chuck it up to just a biological variability for today. And that's that. And then again, they don't account for individual variability. You have a different genetic code, you have different trauma, you have different lifestyles, diets, different factors that influence your blood and chemical level on a daily basis. And so to compare what's optimal and what feels right in your body compared to the population is a little bit, ineffective, right? So again, these tests that are used to compare you to the population, they're never going to get you the answer that you want, because unless you need pharmaceutical intervention, unless they deem it as, yep, you have a disease, everything else in between that gray area, you're left unsupported. And they fail to account for your bio-individuality. Nutrition and fitness is the only science where something can be 100% right for the population and 100% wrong for the other. And that's because of something called bio-individuality. There is no one size fits all approach. And because of your medical history, your trauma, your genetic codes, your lifestyle, your environment, what you need nutritionally and medically to support your goals is vastly different than what somebody else needs. And so that utilizing these averages, these reference ranges, is not going to support you. And in fact, it's going to leave you a little bit more frustrated than it is supported. So if you want to get to the root cause of your symptoms, and if you really want to get rid of them for good, we need to take an integrative approach, which means that we're going to look at your blood work in conjunction with your symptom patterns, which are immediate biofeedback from your body to help us understand what's happening and how do we support that. Another huge consideration with this is blood work is only a single point in time, right? So something can change vastly in your body and at a chemical level from the time that you get blood work till now, right? So your symptoms, however, they're immediate biofeedback and they're constantly changing based on what's happening at that present moment. And so when we use symptoms in conjunction with blood work, that's when we get the most comprehensive approach to supporting your body's needs. And again, it's also going to be targeted because we're able to adapt it based on those changing needs, and it can account for your everyday life, which is attainable. So where do we start? If you are going to get blood work, I recommend that you make it comprehensive. You should at least get your annual blood work that's included with your annual physical. You should also ask for them to test your hormones at multiple points in your cycle, particularly your follicular and your luteal phase, and a full thyroid panel, as well as cortisol and DHEA. Now, if your doctors or insurance will not test for this or they will not cover this, then I recommend getting the women's test through Everlywell. I have linked it in the comments as well as with a code to help save some money. This is the most comprehensive because it looks at hormone levels at multiple phases in your cycle, your full thyroid, as well as your cortisol and DHEA levels. And now remember, I said that blood work is not the gold standard that it used to be. So you also want to use this blood work in conjunction with your symptom patterns to understand what your body's telling you in this exact moment. And when you couple the two, that's when you're going to see the most results. And so if you're confused on how to uncover your symptoms, or you're like, okay, well, what do I do next? I recommend taking my free hormone assessment, which is designed to help you walk through your symptom patterns. And based on your answers, it's going to give you a customized blueprint on what you need to focus on, what's happening in your body, and what interventions you can implement immediately to support. So if you have any questions at all, be sure to drop them in the comments below or reach out to me personally. And if you found this video helpful, please don't forget to like, subscribe.